Healthcare data privacy and security. Healthcare data privacy and security. The healthcare industry generates an enormous amount of data every day. From patient medical records to clinical trial results, the amount of information being collected is vast. With the increasing use of electronic health records and digital medical devices, the security of this information is becoming increasingly important. Protecting patient privacy and ensuring the security of healthcare data are critical issues facing the industry today. Healthcare data privacy. Healthcare data privacy is the protection of a patient's personal, medical, and health-related information. This can include a wide range of information, including medical records, test results, RANS provider information, and treatment plans. In the United States, healthcare data privacy is regulated by the Health Insurance Portability and Accountability Act, HIPAA. This law mandates that healthcare providers, insurance companies, and her healthcare organizations protect the privacy of patient information. HIPAA requires healthcare organizations to implement measures to ensure the confidentiality, integrity, and availability of patient information. HIPAA defines protected health information, PHI, as any information related to an individual's physical or mental health, which is created, collected, transmitted, or maintained by a covered entity. Covered entities include healthcare providers, insurance companies, clearinghouses, and business associates. PHI is protected by a set of standards known as the HIPAA Privacy Rule. The Privacy Rule sets limits and conditions on the use and disclosure of PHI by covered entities. It also gives patients the GHT to access and receive a copy of their PHI. HIPAA violations can lead to serious consequences, including fines and legal action. Healthcare organizations must take the necessary steps to protect patient information and comply with HIPAA regulations. Healthcare data security. Healthcare data security is the protection of information from unauthorized access, use, disclosure, or destruction. Cybersecurity threats in the healthcare industry are on the rise, with healthcare organizations being a prime target for cybercriminals. Healthcare organizations store a significant amount of sensitive information digitally, making them vulnerable to cyberattacks. This information can include patient personal identification information, and financial information and medical records. A successful cyberattack can put patients' privacy and safety at risk and result in the loss of important data. To protect against cyber threats, healthcare organizations must implement a comprehensive security program. This program should include policies and procedures for protecting information, identifying and managing risks, and monitoring and responding to security incidents. The security program should also include regular training for employees on cybersecurity best practices and the handling of sensitive information. With the increasing sophistication of cybercriminals, it is essential that healthcare organizations stay up to date on the latest threats and security practices. Steps to improve healthcare data privacy and security. Improving healthcare data privacy and security requires a comprehensive and ongoing effort by healthcare organizations. The following steps can help improve data privacy and security in the healthcare industry. 1. Implement a security program. 2. Conduct regular risk assessments. Regular risk assessments can help identify vulnerabilities and areas for improvement in an organization's security program. These assessments should be conducted regularly and include internal and external security assessments. 3. Develop and enforce security policies. Healthcare organizations should develop and enforce security policies that meet HIPAA regulations and address specific cybersecurity threats and risks. Policies should cover areas such as password management, access controls, and incident response. 4. Train employees on cybersecurity best practices. Regular training on cybersecurity best practices and the handling of sensitive information is essential for all employees. Training should include identifying phishing emails, protecting passwords, and identifying potential security risks. 5. Use encryption and secure communications. Encryption and secure communications can help protect sensitive patient and financial information and prevent unauthorized access to data. Healthcare organizations should use encryption and secure communication protocols for all forms of electronic communication, including email, video conferencing, and file sharing. 6. Regularly update systems and software. Regularly updating systems and software can help protect against known vulnerabilities and security threats. Healthcare organizations should ensure that all software is up to date and that system patches are applied promptly. 7. Monitor and respond to security incidents. Effective incident response plans should be developed and tested regularly to ensure that healthcare organizations are prepared to respond quickly to any incident. This includes monitoring systems and responding promptly to security incidents. 8. Limit access to patient information. Limiting access to patient information can help reduce the risk of data breaches and unauthorized access to sensitive information. Healthcare organizations should ensure that only authorized personnel have access to patient information and that access is limited to what is necessary for their job responsibilities. 9. Use multi-factor authentication. Multi-factor authentication can add an extra layer of security to protect against unauthorized access to information. Healthcare organizations should implement multi-factor authentication for all systems and applications that contain sensitive patient information. 10. Conduct regular penetration testing. Regular penetration testing can help identify vulnerabilities in the organization's security system. These tests can simulate a cyber attack to identify weaknesses that need to be addressed. 11. Utilize cloud-based security solutions. Cloud-based security solutions offer healthcare organizations secure storage and management of sensitive patient data. These solutions are often highly secure, with multi-layered protections against cyber attacks. 12. Backup data regularly.